Advocating for the frontline workers, physicians, and healthcare workers who are taking care of patients on a daily basis for their physical and mental well-being.
Envision clinicians took to the halls of Congress to share their own stories with their own policymakers about the need for expanded access to behavioral health care for our frontline clinicians.
The more that we advocate on Capitol Hill and in your state houses and others, the better we actually can make it.
We want this physician is portrayed as some form of hero, who's wearing their white cape, who's there to save the day, and then they have no problems whatsoever. But that's not true at any level.
We have physical illnesses and mental illnesses. That fact tends to get obscured.
Although we think that the biggest part of medicine is the time we spend with patients, right now healthcare policy is getting made and nobody's hearing our side of things.
The doctors are human beings themselves. They're going through they're also going through their problems as well, and they need all the support that they can get.
It is so important for clinicians to advocate on their own behalf because they are extremely credible voices within their communities. And legislators listen to them because at the end of the day, one of the most important things to a good legislator is ensuring that their constituency is taken care of.
I think it's important for them to understand how essential something like the Dr. Lorna Breen Act is to the welfare of the current physicians, practicing physicians, and the physicians that will come after us.
At the same time, what we really want to do is make things better for not just physicians, but also for patients. I think that's really the message that I want to deliver to the legislators.
Advocacy is about experiences, right? And expressing the experiences that you have to other people that may not have had that experience. And it's just like any other issue, whether you're a teacher or an engineer or a plumber or an electrician, if there's an issue that you have and the legislature doesn't understand that issue, then they're dependent on you to come and explain to them and fill that knowledge gap.
I think it's incredibly important that we are recognized as not just providers of healthcare, providers of people who can save lives, but also people whose lives are worthy of being saved.
Envision Healthcare wants to ensure that clinicians that want to advocate for themselves are given the tools and opportunities to do it. And for the clinicians who just want to know someone's got their back, we want to make sure they know that we do, and that we're engaging every day on their priorities and on their behalf.